Hi, it's Dr. Centeno, and today I'd like to give you a lecture that I gave at the Med Rebels conference just recently, and it's called The Wild West of Stem Cells. So, you've likely seen that we have a stem cell hype problem. And what I'm going to talk about today, number one, how did we get here? Number two, give you some Wild West stem cell examples. Number three, go through some ethical conundrums. And then number four, draw some conclusions. So how did we get here? Well, way back in 2005, the only people I knew who were doing this kind of work were Dr. Hernegal in Paris, France, and a researcher in Japan. So in 2005, we started doing this kind of work here in the US. Then, around 2008, 2009, we saw a few other doctors join on. And then around 2000, 2011, we saw more, and then an explosion in 2013, 2014. And then really this last 24 months, just an absolute tidal wave of physicians doing this kind of work. So all of this interest is really a two-edged sword. On the one hand, it's great to see that regenerative medicine is finally taking hold. On the other hand, with a lot of different people entering the space, it's kind of really been a mess. So it's now what I call the stem cell Wild West, an explosion in providers that are offering stem cell therapies. Most are very poorly trained. They have very little understanding of the basic science, and there's lots of hype. There's also a new wrinkle in that now we have alternative medicine providers like naturopaths, acupuncturists, and chiropractors that are offering stem cell injections. So it's not just physicians anymore. So let's go into some examples of what's going on. You may have seen these ads in your local paper. They're all over the place in most major papers around the country. And this is what I call the amniotic or cord blood dead stem cell clinic. And I'll talk more about that in a little bit. The reason why I call it a dead stem cell clinic is we did the original research in this area that showed that these products that these clinics were using, which were based on amniotic fluid or membrane or cord blood, are really dead cell products. In fact, they're regulated to be dead cell products. They're not allowed to be live cell products. And sure enough, when you test them, they don't have any living cells. Now that's all well and good, and they may have a use in regenerative medicine, but when you start advertising them as a stem cell product, that's consumer fraud because the cells are all dead. So here is, in fact, the product that this chiropractor who you're about to see speak uses on a day-to-day basis. It's called Palingen Flow Sport. And we tested it, and it had no living cells. It's amniotic fluid / membrane. So,
and then after the child is born, they're able to save the placenta, process that, and then that's where we get stem cells from, or the alternative to adult stem cells. And then finally, placental stem cells from amniotic tissue. We talked about that. The amniotic tissue is so much more active. There's also growth factors inside the stem cells that we use. Okay. So the stem cell injections that we use.
So again, I could go on, but suffice it to say that during this dinner seminar that this chiropractor gave, he must have used the word stem cells 100 times or close to that, and yet there are no stem cells. So this is the worst example of consumer fraud.
And then
Another common claim that we see in these seminars of the same type I just showed you, usually given as dinner seminars by chiropractors, is that you can regrow a new knee using these, quote, stem cell products. You now know they're dead products, but not live products. And the answer is you can't. It's not possible to do. You see here a before and after x-ray, which is a sleight of hand of how the x-ray beam is positioned. Not really any major regrowth of the cartilage. And again, while we can see some cartilage lesions repair with real stem cell treatments, not when there is absolutely no cartilage. Those patients with no therapy, are they ever getting any kind of extensive cartilage regrowth in that knee? That's not how these procedures work. We also see what I call the orthopedic surgeon fat graft equals stem cell clinic. Meaning that this is a guy using a lipogem system, which is a wonderful system to clean fat. It is not a stem cell procedure. It's just a fat graft, but he's calling it a stem cell procedure. Why is he calling it a stem cell procedure? My guess is he doesn't really know anything about whether it's got stem cells or doesn't have stem cells. I know this is a good company. I know the company is out there actively telling their reps to tell these physicians not to advertise this as a stem cell procedure, but physicians are doing it anyway. I also know this is a good company, the folks that make AmnioFix. They also claim no live stem cells. They make no bones about it. Their reps don't claim live stem cells. They are a very solid company. They're doing research in this area. And yet this picture was texted to me by one of my patients, and an orthopedic surgeon told him that this was a stem cell treatment. Now this is dehydrated and gamma irradiated so that we're sure it's 100% dead, and yet this orthopedic surgeon was treating it like sea monkeys, i.e. you just add a little water, it all comes to life. That doesn't happen with human cells. Works great with sea monkeys. And what are the risks of leaving this space out of control? Well, very, very clear as of just about 6 weeks ago. FDA Commissioner Scott Gottlieb came out and stated that he was going to be cracking down on stem cell clinics. Since then, he's been focusing on bad actors. He took out a clinic in Florida. He's taken out a clinic chain in California, or at least has sent warning letters to both. And in the case of the California clinic, there was also involvement of smallpox vaccine, and then since then a 483 showing multiple deficiencies. So the FDA is very clear that they're going after the bad actors in this area, and yet we really as physicians haven't cleaned up our own act. So let's look at some ethical conundrums. These are just kind of random examples of things not to do. So one of them is non-physician orthobiologic providers. So at chiro clinics, we're seeing even a new thing emerge. It used to be that there was a physician that was hired, or that there was a nurse practitioner, a PA, who was actually doing the injections. But we're now seeing something new. We're now seeing medical doctors or osteopaths who bill themselves as, quote, medical advisors who are selling their supervision services so that the chiropractors themselves, or in one case, an acupuncturist, can perform these injections that they're not allowed to perform on their own licenses. So let's also now look at what is legal, what's not legal. The FDA regulations right now are largely being ignored. A good example of that is using stromal vascular fraction or enzyme digested fat. This constitutes the manufacturing of a 351 biologic drug. That means if you take fat and you digest out with enzymes or even mechanically with vibration to try to separate the cells, that's a 351 illegal drug. However, that's being done all over the place. So what else is a violation of FDA law? Well, as a physician, you should get to know Section 301 of the FDCA. this basically says that if you're involved in using an illegal drug or promoting an illegal drug or even purchasing an illegal drug, you're as liable as the guy that made it. So what's currently a misbranded and adulterated drug that you can receive, and the operative term here is in interstate commerce? Well, scenario one, you order and pay for amniotic or cord blood, and there are two types out there. There are the types that are doing this correctly and just saying, hey, I've got amniotic tissue or I've got cord blood. I'm not making any claims about it. It is what it is. It may have some growth factors in it, but you figure it out, doctor. In which case, that's a 361 tissue and you're fine. Then there are folks out there who are claiming that these vials of, let's say, amniotic fluid or cord blood have stem cells. Just that claim, whether or not there are stem cells in there, makes no difference. Just the claim of living cells makes this an illegal drug. And you are liable if you purchase it. So again, if you purchase from a company that's making a claim that it has live cells, you are as liable as the person that's making that claim. And if you put it on your website and claim that you have live cells, you're also making a claim yourself, tying yourself back through Section 301 of the FDCA to the original violation. Scenario two, we've seen this one too. We're seeing now companies that will culture expand fat or bone marrow, saying that they're part of an IRB approved study. And this stuff's being shipped in interstate commerce. Now that's insane because it's very, very clear that there is no study that can be performed outside of an FDA approval study where you're allowed to use culture expanded cells. And yet we're seeing physicians do this now. I've heard of many physicians who are doing it. We've made some phone calls and we've confirmed that physicians are doing it. One group went so far as to actually put on a webinar that they were doing it. So let's talk about outcomes. How do you stay on the right side of the ethics for outcomes? Well, as an example, if you just put some random number on your website that's saying that 80% of our patients get positive results, that's not appropriate. You need to have information to back that up. Now, you can participate in a registry and put those results on your website. You could also just give your patients forms to fill out, and after 6 months or a year, you'll have enough information to put up on your website. But don't just make it up, which is really what we're seeing. In fact, I called a chiropractic clinic locally, and what I was told was that there was a 97% success rate. Now, 97% doesn't exist in anything in medicine, certainly not in stem cells. So again, recognize that when this kind of thing is put on a website or when this kind of thing is told to a patient, it's consumer fraud. There is absolutely no basis for that information other than we kind of think that our success rates are high. That's probably a better statement than saying they're 97% or 80%. And again, in this world of investigational care, treating patients without collecting outcome data is below the standard of care. You are required for all investigational care to collect data. And if you're not doing it as a physician, shame on you. You need to be doing this. You need to be spending the money to do this. You can use one of the several registries that are out there to do it for you, or you can do it yourself if you don't want to spend that money, but it needs to be done. As an example, all of our outcome data collected through our registry is updated each month and is put on the web. You can pull it up and slice and dice it. You can pull up knee information, shoulder information, hip information. You can do statistics on it. You can look at various metrics. It's all there in complete transparency. And I would encourage you all to do the same. And if you don't have the technology to do that or don't have the resources to do it this way, do it another way, but do it in some way. As an example of how you can get in trouble, this is actually a lawsuit against a group out there right now where they claimed 100% customer satisfaction. Well, regrettably, 100% of the customers really weren't satisfied and they got sued in a class action. So the research bait and switch, we see this all the time and patients fall for it all the time. So as an example, if you post research that's done by others on your website, you need to make sure that it uses the same exact procedure that you use. So let me give you an example. This is actually a fat-based stem cell clinic out of Florida, and I looked at their website to try to see, these are all the different conditions on the left here, everything from traumatic brain injury to macular degeneration that they claim they could treat. Off on the right there, you see if there was any scientific evidence for using, in their case, fat-based stromal vascular fraction, that was their stem cell source, to treat those things. And there wasn't for the vast majority. And the little bit of research they'd actually posted on their website to support that they could treat these things didn't actually use stromal vascular fraction. They used bone marrow culture expanded mesenchymal stem cells, which is completely different. So again, it's a research bait and switch and unethical. Let's look at 361 tissues. We've already looked at these a little bit. We've looked at these when I talked about section 301. We've talked about the chiro clinics, but let's delve into this here because as a physician, I want to teach you how you can dive in to information that you're given. So we're going to go into this in a little depth here. As a physician practicing in this area, we see that our physicians get approached sometimes 5 times a month by companies claiming that they've got millions of live stem cells in this vial of amniotic tissue or cord blood. And sometimes a white paper will be given to them that seems to prove that there are millions of stem cells. But I want you to be able to dig into the white paper and understand what's going on. So let's dig deeper into one of these white papers that was given to a physician. So in this particular case, this is a scientific examination into a cord stem cell vendor's product white paper that claims that there are mesenchymal stem cells in their cord blood. So this is the viability testing that's in the white paper. It says 75% viability. Now that's actually pretty good for a cord blood product. It's towards the higher end. We've seen as low as 35% viability all the way up to about 75% viability. So to put that information in context, the first thing you need to know is that normal recovery rates out of cryopreservation when the cells are properly recovered is about 90+%. Properly recovered is very different than what happens in a doctor's office. In a doctor's office, doctors are doing what's called shock thawing. They're basically taking these cells and warming them in their hand, getting it to be a liquid, and then injecting it. Now, that's not how cells are actually properly recovered. In a lab, cells are properly recovered through controlled rate thawing over a number of hours, and then they are actually placed in recovery culture for several days to try to get them healthy before they're re-injected. So another thing you should know is that this viability test that I just showed you doesn't really measure viability as you and I would probably conceptualize it, meaning that it puts in the same category the guy on the left here who's running and the guy who's in the ICU, meaning that cells can be very, very damaged and still end up being counted as, in quotes, viable. In fact, cells can be in the process of dying and still counted as viable with that test. So that test has got some major issues. It's a nice, quick, and dirty test, but it by no means gives you all the information you need. So recovery rates of 75% for hardy fetal cells generally means that these cells have been through heck and back, meaning that if I was working down at our licensed clinic in Grand Cayman where we use culture expanded cells out of cryopreservation, and the lab told me that the recovery rate was 75%, there would be something seriously wrong with those cells, and I would think twice before I injected them into a human being. So recognize that if I don't get at least high 80s, and much more commonly low 90s into mid 90s as far as recovery rates are concerned, there are something wrong with those cells. So how many MSCs could there be in cord blood? Let's just look at that concept. I mean, this is a simple thing. Does cord blood even have mesenchymal stem cells? The answer is not so much. If you look at these three studies, in two of the studies, they got stem cells, mesenchymal stem cells recovered only about in 1 in 10 of the umbilical cords, or only about 10%. In the other study, they got them about 20% of the time. So if there are mesenchymal stem cells in umbilical cords, they are very, very rare and very, very hard to isolate. Next comes the flow cytometry. Now, we read here in this white paper that it says that in this study we analyze, whatever regenerative medicine product, we performed in vitro studies, yada, yada, yada. But look at the fine print, which may be indicative of the presence of stem cells and other immune cells. So basically, on the one hand, while if you read this white paper, it's all about the stem cells, because that's the marketing push that the company is making. In fact, if you read the fine print, it says, we're not going to really tell you only about stem cells, we're going to tell you about other cells as well. And they reference actually the correct paper for trying to identify mesenchymal stem cells with flow cytometry. So what is flow cytometry? Flow cytometry basically means that you use a laser to look at the receptors that are on the surface of the cell to try to identify the cell. And this paper is the seminal paper that's used to do that, so that's the one they reference. To identify a mesenchymal stem cell, you need those markers that are present on the surface of the cell, and these markers that are not present. So again, it's not just the ones that are present, it's also the ones that you can confirm are not there. You also need to make sure that the cells are plastic adherent in culture, and that the cells must differentiate to osteoblasts, adipocytes, chondroblasts in vitro. So what did the flow cytometry find in this white paper? Well, they certainly didn't find there were mesenchymal stem cells, because if you look here, they didn't even test for these two markers. Why would you not test for those two markers? Those are the two markers you need to test for in order to be able to say that you have a stem cell. And your markers need to lack expression of all this stuff over here. So again, very, very clear that what happened here certainly was not trying to identify stem cells. So the MSCs that they tried to identify weren't tested using these standards that they referenced. They also made no attempt to try to see if these things were plastic adherent in culture, and they made no attempt to try to see if they could differentiate into other types of cells. So now let's look at complications. Recently saw these articles, I'm sure, all over the internet, showing that patients lost sight after having fat-based stem cells or stromal fraction injected into their eyeballs. Now, there was no animal model that showed that you should be injecting fat into eyeballs. And in fact, there are even more cases out there, apparently, than these three, according to more recent reports. So this is a great example of what not to do. Don't try stuff in patients that doesn't have an animal model. Now, in orthopedics, that's a little bit easier because a ligament in one area is very similar to a ligament in another. But in this case, no one in an animal had ever tried to inject stromal fraction into the eyeballs to treat eye diseases. And yet this was done in human patients and it went bad. So it's very easy to use PubMed to see what's studied in animals, and you can see that very, very quickly. So in conclusion, what can you do? Sign on to the Orthobiologics ethics statement, which is online. If you just go online and Google and type orthobiologics ethics, it'll come up in the search results. There are a lot of companies and individuals who have signed on to that to abide by certain ethical standards. You can become active in calling out fraud. Doctors are taught not to rock the boat, but in this case, you need to rock the boat. In this case, you need to be able to look at someone and say, that's not right. You shouldn't be doing that. And you need to collect data and publish data. Be a part of trying to solve the issue of a lack of data in this area by collecting it and publishing it. So these are promising technologies in summary. They have limits and they are investigational. They're not magic. You are a serious medical provider, so be a serious medical provider and add to the field rather than taking from it. So thanks so much for watching and have a great day.